This talk is an overview of the Perspectives of Psychiatry. The Perspectives of Psychiatry are an approach to psychiatric formulation using 4 explanatory models for how psychopathology develops: the diseases model, the dimensions of personality model, the motivated behaviors model, and the life stories model. Let's outline the different perspectives and how they inform diagnosis and formulation. Each perspective is useful for describing the cause of different psychiatric disorders. The disease perspective is used to explain disorders that have a basis in biological pathology, for example, brain structure and neurotransmitter abnormalities. These disorders are heritable and therefore thought to have a genetic basis. This model is closest to the traditional medical model of disease, in which problems in biological function can be traced to specific pathological findings at the level of cells, tissues, organs, or organ systems. This perspective is used to explain depressive disorders, manic disorders, psychotic disorders, neurodevelopmental disorders, and neurocognitive disorders. The dimension perspective is used to explain disorders that represent extremes of psychological traits, in other words, extreme personality traits. This perspective is used to explain anxiety disorders and personality disorders. For example, introversion and extroversion exist on a spectrum, and while there is healthy variation in this trait, extreme introversion can manifest as avoidant personality disorder and may lead to significant distress and dysfunction. The behavior perspective is used to explain disorders involving learned behaviors. This includes maladaptive patterns of coping that become reinforced and highly motivated over time. You can see how this cycle plays out below. This perspective is used to explain substance use disorders, eating disorders, disruptive behavior disorders, and sometimes self-injurious behavior. Finally, the life story perspective is used to explain disorders that arise from significant experiences and how these experiences influence our beliefs and behavior. These include early life experiences and attachment relationships, but also include traumatic experiences and losses later in life. This perspective is used to explain trauma-related disorders, attachment problems, adjustment disorders, demoralization, and grief, among others. These are the 4 perspectives. Each of the perspectives provides a model for understanding particular disorders, but it's also important to understand how these different disease processes interact with each other. Here is one way of understanding these interactions. Biological disorders affect a person's characteristic way of interacting with the world, thus affecting their psychological traits, and to cope with problems in life caused by unhealthy psychological traits, they then develop maladaptive patterns of behavior. Independent of underlying biology, a person will have numerous experiences in life that contribute to the development of psychological traits and habitual behaviors. Therefore, biology and experience, in other words, nature and nurture, independently influence the development of our psychologies and behaviors. Another way of visualizing this is with biology as the core problem and traits and behavior as emergent properties of this core problem. Again, experiences exert an independent influence. Let's go through an example to demonstrate these interactions. Consider a person who has major depressive disorder. Due to feeling depressed most of the time and developing low self-esteem from an early age, this person may develop avoidant personality traits and eventually develop an alcohol use disorder as a way of coping with social anxiety. Although the alcohol use disorder is what is seen on the surface, this is masking an underlying major depressive disorder. Traumatic experiences throughout the person's life could exacerbate these traits and behaviors. This is how the 4 perspectives can be a very powerful model for understanding a patient's problems. Let's conclude by outlining how to use the perspectives to inform treatment. Each perspective requires a specific type of treatment. Biological treatments, such as medications, are aimed at treating underlying disorders and managing emotional abnormalities. Psychological treatments, such as psychotherapy, are aimed at treating accumulated psychological impairment and correcting maladaptive thoughts. Finally, social treatments, such as behavioral interventions, are aimed at treating maladaptive coping and correcting maladaptive behaviors. Of course, you cannot undo experiences that have already happened, so there's no specific treatment modality for the life story perspective other than managing the traits and behaviors that emerge from experiences. Finally, let me draw a connection between how the perspectives map onto the biopsychosocial method of formulation and to the cognitive triangle of emotions, thoughts, and behaviors in cognitive behavioral therapy. That's the end of this talk. The Perspectives of Psychiatry has been very influential in my understanding of psychiatric care, and I hope it serves as a useful framework for you too. Thank you.